Hello and welcome to Mimi's Corner, where we give you the latest news, gist, and gossips. To all our listeners and subscribers, we say thank you for always tuning in to listen to us. If you are just joining us, we say welcome to Mimi's Corner. Kindly click on the subscribe button to subscribe to our YouTube channel. Also, do not forget to like and share. Also, click on the notification button to be the first person to get an update when we upload our news. Thank you for tuning in. And now to the news of today. The headline. Just in. Nigeria records 39 Mpox, 5,951 cholera cases. And now to the main news. The Nigerian Center for Disease Control and Prevention on Thursday said Nigeria had recorded a total of 39 confirmed cases of Mpox and 0 deaths across 33 states and the Federal Capital Territory from the beginning of 2024. The NDDC Director General Dr. Jide Idris, who disclosed this at a press conference in Abuja, also said the country had so far recorded a total of 5,951 suspected cases and 176 deaths have been recorded across 36 states and the FCT as of August 11, 2024. The African Center for Disease Control on Tuesday declared a public health emergency over the growing Mpox outbreak on the continent. The outbreak has swept through several African countries, particularly the Democratic Republic of Congo. There is a serious and growing outbreak in the Democratic Republic of the Congo that has now expanded outside the country. A new viral strain, which first emerged in September 2023, has for the first time been detected outside DRC. So far, about 2,863 confirmed Mpox cases and 517 deaths across 13 African countries have been reported in 2024 alone. In Nigeria, cumulatively, a total of 39 confirmed cases and 0 deaths have been recorded across 33 states plus FCT from the beginning of the year 2024. Bayelsa 5, Cross River 5, Ogun 4, Lagos 4, Ondo 3, and Ebonyi 3 lead the pack. Noting the significant concern of the ease of cross-border transmission, this press conference is part of the effort to intensify our coordination and communication with stakeholders to manage the spread of the virus and prevent disease importation, Idris said. Mpox is a very viral zoonotic infectious disease of animals transmitted from animals to humans that is endemic in several African countries, including the tropical rainforest of Central and West Africa. The exact reservoir of the virus is still unknown, although rodents, squirrels, and monkeys are suspected to play a part in transmission. The Mpox virus can spread both from animal to human and from human to animal. Animal-to-human transmission may occur by direct contact with the blood, body fluids, skin, or mucosal lesions of infected animals, example monkeys, squirrels, and rodents. This can happen through a bite, scratch, handling of, or eating inadequately cooked or other products of infected bushmeat. Human-to-human, person-to-person transmission occurs when a person comes in contact with the virus from an infected human or material contaminated with the virus, such as clothing or bedding. Symptoms of the illness include fever, headache, body aches, weakness, swollen lymph nodes, glands, and a rash. After about 1 to 3 days of fever, the rash erupts, beginning on the face and then spreading to the body, with the face and palms, soles being mostly affected. They can also occur in and around the genitals, which is why contact during sex is another mode of transmission. The NCDC DG noted that the National Mpox Technical Working Group, a multi-sectoral body housed with the NCDC, continues to coordinate Mpox response activities. As part of the government's ongoing efforts, we have intensified surveillance across Nigeria to swiftly detect and respond to any new cases. This puts all port health services across all 5 international airports, 10 seaports, and 51 land or foot crossing borders on high alert. Diagnostics protocol, according to the Integrated Disease Surveillance and Response, are now distributed to these locations, and port health officers are on high alert and screening for suspected cases. Some states have also been put on high alert, including Lagos, Abuja, Enugu, Kano, Rivers, Cross River, Akwa Ibom, Adamawa, and Taraba. We are also conducting contact tracing and monitoring for confirmed cases to prevent further spread. This would now also include a declaration by travelers who have been to any of the countries where there has been an ongoing outbreak of Mpox in the last 90 days, he said. He stated that the agency is considering vaccination efforts for high-risk groups as Nigeria expects to receive 10,000 doses of Jynneos vaccine. Giving an update on cholera, he highlighted that as of August 11, 2024, a total of 5,951 suspected cases and 176 deaths have been recorded across 36 states and the FCT and 152 LGAs with a case fatality rate of 3.0%. This data reflects a continued increase in the number of cases being recorded across the country. So far, the most affected age groups are less than 5 years old. The trend of suspected cholera cases is anticipated to exhibit fluctuations and may persist until epidemic week 37. This projection is consistent with the patterns observed in cholera outbreaks in Nigeria from 2020 to 2024. The current rainfall forecast suggests that there may be an increase in the number of cases. Contributing factors to the outbreak include high rates of open defecation, which leads to contamination of water sources through the runoff of fecal matter. In response, we will enhance both prevention strategies and case management measures to effectively address and mitigate the outbreak. Well, I really hope that individuals on their own part would try everything possible to prevent themselves from getting this outbreak disease, this Mpox and the cholera. Try not to eat food from unverified places where you don't know how they prepare the food. Try to wash your hands. Try to take note of the things that are entering into your mouth, and hopefully the outbreak would be limited. My listeners, what do you think? Kindly leave your thoughts in the comment section. Do not forget to like, to share, and to subscribe to our YouTube channel. Thank you for listening. See you some other time. Bye.